Good afternoon, everyone, and thanks for joining us for a Tax Practitioner Board webinar. My name is Lun Lak, and I'm hosting today's session. Today, I'm joining you from Gadigal country. I respectfully acknowledge the traditional owners and custodians of country throughout Australia and their continuing connection to land, waters, and community. I would like to pay my respect to them and their cultures and elders past and present. To begin, I have some quick housekeeping messages. First, to obtain a copy of today's slides, you can visit our webinar resource hub at tbb.gov.au/webinar hub. We'll also email you a copy of the slides following the session. Today's webinar counts towards your continuing professional education or CPE, and you can claim 1 hour for attending. We will also issue an attendance certificate to those of you staying online for the duration of the session. Today, we'll begin with a quick refresher on the TPB's mental health and wellbeing policy. Then I'll hand over to our Beyond Blue presenters, who will be sharing insights about the global trends and their local impact on mental health, what support is available to you, and how you can support your clients. And at the end of that session, we'll answer some of the questions that we received during the session, so make sure you submit your questions using the Q&A. To find the Q&A, simply move your mouse over the screen and a range of icons will appear. You can also use the chat function to speak to other participants, but if you need a response from us, be sure to use the Q&A. And also, to disable any of these functions, simply move your mouse over the relevant icon and unselect Show Preview. So let's take a quick look at our mental health and wellbeing CPE policy. Here at the TPB, we recognize the importance of managing your mental health and well-being, which is why our CPE policy helps support you. As I'm sure you all know, when it comes to CPE, the CPE activities you undertake must be relevant to the tax agent or BAS services that you provide. However, these CPE activities need not be limited to only those areas that help improve your technical knowledge. Other areas such as practice management and ethics are also relevant and important to ensure you provide a competent service to your client. Importantly, for today's conversation, your CPE activities can also include up to 10% of educative health and wellbeing activities over your CPE period. Now, these activities could include attending courses or webinars about how to manage stress, self-care, and supporting mental health and well-being of yourself and your staff. Now, I would like to introduce our first speaker for today. We're very fortunate to have Dr. Luke Martin and Irene Verins from Beyond Blue joining us today. Dr. Luke Martin is a wellness and prevention engagement manager and a clinical psychologist who is focused on driving social focus and behavioral changes that help people stay well. So thank you for joining us today, Luke. Over to you to get things started.
Thank you, Lynn, for that introduction. And hello, everybody. Great to see so many people joining us online. I'll just wait for Lynn to stop sharing the screen so I can quickly bring up my slides.
So, Luke, they have the notes on them at this point.
Fantastic. How about now? Is that okay?
That's great.
Beautiful. Thank you, Irene. So yeah, as Lynn mentioned, so today we're talking about, some of the global trends that are going on in the world at the moment and how they're impacting our local mental health. And so we think this is a really important conversation. So we're so glad that so many of you have joined us online for it today. We hear from our community at Beyond Blue pretty much every day that we're living in some interesting times, some challenging times. And so it's great to have a focus on that in this conversation. Because we know at Beyond Blue that our mental health doesn't exist in a vacuum. It's influenced not just by what's inside us, but also by what's going on around us. And we know what's going on in the world at the moment can be making people feel a little unsettled or wearing us down. So today we're going to really look at what are these issues and trends that are going on, how are they affecting us, and with a particular lens for, as a tax practitioner, how might they be affecting your clients and how can you support them and yourself? So just a very quick reminder, because we are talking about mental health today, that the Beyond Blue support service is available 24/7 on 1300 22 46 36. And there's a range of other support options on the slide as well. And just a reminder that even if you are worried about someone else, maybe it's a friend, a family member, or a client, if you're worried about their mental health and how they're going, and you're not quite sure how to handle the situation, you can call the Beyond Blue support service and get some advice from our counsellors about how to handle that situation and how to have that conversation. And so I will hand over to Irene to tackle the first half of today's webinar, which is really outlining these big trends that we're observing. And then I'll take the second half of the webinar, which is more about what can we do about it collectively and individually. How do we handle these challenges at the moment? So Irene, I will pass the baton to you to take it from here.
Fantastic. Thanks, Luke. And if you could just move to the next slide, that'd be great. Hi, everyone. I'm absolutely delighted to be speaking with you today. And I think trends are fascinating. So what we want to do today, very briefly, is just take you on a bit of a tour of some of the major trends and kind of social forces that are currently encircling our lives, the lives of our families, your clients, and your children, potentially. And before I do that, I just want to say a trend is really about the general direction in which something's developing and changing over time. It's transformative, and often it requires us to sort of act and adapt or change what we're doing as well. So it's important to be aware of trends. And whilst some of them might paint a little bit of a bleak picture, many trends are really way beyond our influence. They're at that kind of macro level of existence. But others are also closer to home and are certainly within our control. And the reason we talk about trends to everyone is that even just the kind of consideration of what we can control, what's outside of our control, is really important to maintaining a sense of mental well-being and kind of empowerment. So that's really the reason we're talking about the broader trends today. Thanks, Luke. Okay, so really the challenges that are impacting our mental health are becoming more complex every day. We're all feeling a little vulnerable and a little bit untethered at the minute, I think it's fair to say. And we have borrowed this framework called the VUCA framework, which really kind of conceptualizes the world where we're all living and where we're working. It stands for this. The V is for volatile, meaning change is rapid and unpredictable in its nature and extent. Uncertain means the present is unclear, and the future is also uncertain. It's complex, and that means there are many different interconnected factors that come into play with the potential to cause chaos and confusion for people, and it's ambiguous. So there's a lack of clarity or awareness about situations, and in total, the VUCA environment has really started to give rise to an increasingly alarming set of sort of complex and interdependent factors that all impact on our mental and physical health. So this is what we have here is by no means an exhaustive list. It's a list that Beyond Blue created in our sort of scoping work originally. But we're seeing impacts across every facet of life. And this list actually makes up the trends that we're exploring and going to be talking about today. So in short, as a summary, social cohesion we know is declining. More people are feeling lonely and isolated. And those increases are particularly noticeable amongst young people. And we'll talk a lot about that today. And it's not just connection, social connection between people that's lacking, it's actually cohesion. So people appear to be feeling more divided on a number of issues these days than ever before. We'll explore that as well. The 24-hour news cycle means there's a constant kind of bombardment of crises and very divisive kind of political discussions. And they all play a role in detracting from our sense of stability and well-being. And they increase and result in a sense of raising alarm within us. Now, in terms of economic uncertainty, inequality and cost of living crisis is real and continues to erode the mental health of many of us. And we've gone really from a sort of pandemic to a cost of living crisis, all against the backdrop of an unprecedented kind of series of adverse weather events and climate, which is also contributing to increased anxiety and trauma. And finally, technology is this kind of rapid train of positive and terrifying outcomes. Next slide. Thanks, Luke. So the consequences of all of this are pretty clear and stark. The prevalence of mental health issues shows that this is impacting us profoundly. Indicators show a steady decline in adult mental health since 2016. Alarmingly, though, there's been an incredible 50% increase in young people's mental health conditions, and certainly rising levels of distress and loneliness for them. And this is a group, when we talk about young people, we're talking about people in that 16 to 24, 25 age range. Now, these worrying experiences and trends for young adults in particular will become a thread of conversation amongst our presentation today, but it's also important for us all to remember that the challenges that individuals and communities are experiencing and how they might not only affect their mental health, but how they might also appear and present in terms of affecting their interactions with all of us, amongst us. So your clients, your children, your family, your staff at work, your suppliers and stakeholders, patients, workplaces, etc. People are impacted by this, and it is noticeable. And so what we want to do is really raise your awareness of the fact that all of these things do have an impact on mental health and wellbeing, and you might yourselves be seeing it, even though you're not aware of it, in the people that you see and spend time with in your private and business and public life. Thanks, Luke. So the first trend I really want to talk about is economic. So in January 2024, the Australian National University conducted an opinion poll and found that 34.2% of Australians were finding it difficult or very difficult to get by on their current income. 62% said they were spent less on groceries and essential items, and this is despite the fact that food prices are in fact increasing. So they're spending less money on groceries, but prices are still going up. 36% of households experienced food insecurity, and for 77%, it was the first time, which means that the number of people who are experiencing food insecurity is increasing still. We haven't reached a plateau. Australians who are falling behind with their loan or rent payments has more than doubled in the last 12 months, and there's also a very large decline in the proportion of Australians who think owning one's home is part of the Australian way of life. And as you can see from the quote, the last time I couldn't afford enough food for the family, I just got creative in the kitchen for the kids and didn't eat myself. I ate Milo and Bickies from the work staff room to tide me over. I think speaks volumes to the kind of the way that people are managing these crises at the moment. Thanks, Luke. So when we consider the mental health impact and those most at risk, the picture is a bit concerning. Having a job doesn't necessarily protect you anymore from financial and psychological distress. And we know some of the biggest increases in cost of living distress were amongst full-time workers, as well as households earning over $100,000. A Beyond Blue survey found a staggering 83% of respondents said financial pressures were having a negative impact on their mental health. And cost of living and a personal debt was also the main cause of elevated distress amongst Australians reporting suicidal behaviours as well at 58%. Sorry. Now, living in financial stress long-term is cumulative and can actually lead to shame, anxiety and hopelessness. And cost, as an example, cost was the number one barrier, for people accessing mental health support. So with 40% of people saying they delayed help seeking due to cost-related reasons, which is really disappointing and very worrying for organisations like Beyond Blue. Now, gender also plays a role in economic stress and poor mental health, in that women often experience financial distress very differently from men. And in various surveys that we looked at, women reported higher levels of financial stress than men, because of their involvement in, say, unpaid or underpaid labour, domestic violence potentially, and also the disproportionate responsibility they shoulder in managing both household finances and costs, but also managing those costs with less money in their purse each day. Women are often the ones who have to renegotiate the repayment of loans or easier ways of repaying debt at this point. The impact of this and other stresses on women's mental health is reflected in 45% of females having a mental health disorder at some point in their lifetime. Now, the negative impact of economic stress on the mental health of men and boys is very concerning also, with men less likely to seek help while being more likely to die from preventable illnesses and suicide. So they are different and both equally as important and a bit devastating, to be honest. Thanks, Luke. The next trend that I want to take you through very briefly is around the social sort of sphere. And the evidence tells us that social cohesion, which includes belonging, participation and trust in society and institutions, is good for our mental health and well-being. It underpins resilience to disasters, our ability to bounce back, and it is vital to reconciliation and acceptance of diversity in our community more broadly. It's also really good in terms of making people feel generally safer. And what we know, though, is that from the Australian National University Opinion Poll, Australians' general satisfaction with their own life and the direction of the country has in fact declined. And it's declined for the first time in many years, which is a bit of a concern. A recent and uncharacteristic decline in belonging, feelings of safety, as I mentioned, and trust in government and community institutions, diminished feelings of safety compared with previous years, and decreased participation in voluntary work in social, political and community groups was also recorded. Now, a further trend that undermines social cohesion is loneliness and social isolation. And we know that 1 in 6 Australians are currently experiencing severe loneliness, and this is particularly with that 18 to 24-year-old age group. They're experiencing the greatest loneliness. Now, people lacking social connection face a higher risk of early death and a series of mental and physical conditions as listed. Social isolation and loneliness do not just harm individuals also. They're also a negative impact on the entire community, as I mentioned, and society at large. And research shows that safety, prosperity and effective governance depend greatly on the quality of the social connections within neighbourhoods, at workplaces, within schools and other organisations. Now, overall, loneliness is significantly associated with stigma, shame and concealment, as I'll show in the next PowerPoint, Luke. And I just want to draw your attention to this really great report that was developed last year. It's developed each year for the last couple of years by an organisation called Ending Loneliness Together. And they developed this report called The State of the Nation. And really, they interviewed a large sample of the Australian community on a range of their experiences around social connection, loneliness and isolation. And I think some of these perceptions and misconceptions of loneliness are remarkable and very troubling. So this is what others are thinking about people who are lonely and socially isolated. And I just want to draw your attention to the column on the right-hand side. So at the top, 46%, nearly 1 in 2 Australians describe people who are lonely as having negative traits. 1 in 4 think that people who are lonely are less worthy than others. And 1 in 10 Australians believe that there's something wrong with people who are lonely. And more than 1 in 4 think their community believes that loneliness is a sign of weakness. Now, I think that's really staggering given how important we know social connection and loneliness is, but it's also something we need to act on if we feel that you know, as we see, this is a very broad sample of Australian people who have these misconceptions really about the nature of loneliness. The next slide would be great. Thanks, Luke. Okay, so I want to turn to environment now, and Beyond Blue and the Climate Council in 2023 released foundational research that found some really interesting outputs. So 80% of Australians experienced some form of natural disaster since 2019, with more than half feeling that their mental health had been impacted. There's a clear rural-urban divide when it comes to experiences of extreme weather and the impacts of climate change, with people particularly living in Queensland and New South Wales being most likely to have experienced multiple disasters since 2019. Experiencing successive disasters, or as we call them, compound events, can also have a very cumulative impact on your mental health. And the Australian Psychological Association coined the phrase pre-traumatic stress disorder, which basically occurs when people display symptoms consistent with PTSD or post-traumatic stress disorder in anticipation of climate events. So they haven't felt them yet and they haven't gone through them yet, but they're already anxious and at a very heightened level of concern. Now, there's a new language that's developing, and no doubt some of you may be aware of this already, or you would have heard it from your friends, family, children perhaps, to better name the effects of climate change and weather events on our mental well-being. So eco-grief or ecological grief or eco-anxiety are terms that describe anxiety that people feel related to climate change, including the loss of a stable future. Now, while eco-anxiety is a normal response to climate emergencies and does not usually rise the level of clinical concern in and of itself, it may shape people's views of society, their future, and potentially lead to anger, hopelessness, a sense of paralysis. And we're seeing this particularly amongst young people now. So of note and great concern for health services recently, in the last couple of years, is that the death toll from heat waves in Australia, which exceeds that of any other environmental disaster. I found this statistic this fact quite interesting. I wasn't aware of that, to be honest. But the reason that heat stress is so important and so pervasive in Australia is that it impacts vulnerable communities most, and it's a direct outcome of financial distress or people in poverty and their experience of high energy costs. So significant adaptation actions are taking place across Australia now to try and mitigate some of those experiences. Technology use, we know that it's more than simply a mechanism or tool for doing things. Instead, digital technologies in particular are an intrinsic part of the environment in which we all now live, learn, relate, grow, work, with schools, workplaces and communities all increasingly reliant on digital technology to function. So we think that digital technologies actually simultaneously present opportunities and challenges. Australia has so-called great penetration in terms of digital technologies, with more than 25 million internet users and 20 million social media users from January 2024. And what is a bit startling is that more than 4 in 5 children own at least one screen-based device that belongs to them, with ownership commencing as young as 4 years old. Now, parents were significantly concerned about negative impacts of digital media and technologies on their children's physical activity levels at 73%, on their children's attention span at 62%, and at time for and interest in play at 62%. But interestingly, parents also believe that the impact of digital media and technologies on their children has been more positive than negative on their child's mathematical abilities, their reading abilities, and their social skills and friendships. 83% of parents, carers and grandparents felt that their child was negatively distracted by digital technologies, but then over 90% of Australian parents also felt that they themselves were negatively distracted by digital technologies. So go figure, this is such a conflicted and sort of interesting and sort of confused space in terms of what people are experiencing, what they think is happening to their children and to themselves, how they're engaging with digital technologies as well. So I think it's fair to say for all of us that we have to do a lot more research and talk to a lot more users of technology generally to really get to a point where we can say definitively that it is either a good or bad thing. And I don't think we should get there. I think we should try and simultaneously begin to build our knowledge around experiences and mitigate the risks as they develop. Now, over time, in the last 15 years, a number of indicators of psychological distress have been increasing at a rate higher for 13 to 25-year-olds compared to other population groups or age groups in Australia. And Luke, if you could go to the next slide, that'd be great. The National Mental Health Commission has been investigating what the drivers behind some of this rising rate of distress and psychological distress is. And one of the processes that they've undertaken in a recent report is really to look at what a range of drivers are and what some of the significant cultural changes to the world might be that might be accelerating some of these levels of distress. So these are the kinds of categories that they created. They included some of the pressures that we are considering today in our talk and have delivered on, but also including pressures as they relate to these categories: family, parenting, employment, physical health, sociocultural shifts, and uncertainty about the future. And in the interest of time, I just want to focus on the red box that I've outlined, the digital tech impacts that these factors result in, which in turn impact mental health. So if you look at the family and parenting one, you'll see that the digital impact for family and parenting is really about increased information and avenues to compare yourself against others. Now, parents, we know, actually experience some level of distress and anxiety around, am I a good parent? Am I doing the right things? Am I experiencing, am I well informed? And that kind of level of confidence or lack of confidence or anxiety can also have a flow-on effect of anxiety to children as well. So if you look at the physical realm, what impact does digital tech have? So slide along to the right, and there are increased mechanisms of sleep procrastination, which means that we know from research, and actually Luke's quite expert in this field, that engaging with digital technologies does have a negative impact on sleep. And again, there's also, in terms of avenues for comparison, that digital technology allows us to see. So much of Instagram and Pinterest and the digital technologies and social media that children are on allow them and create opportunities for avenues to compare themselves against others. And that does increase a level of anxiety and distress amongst the young age group in particular. So we know that there's a range of drivers that are impacting on mental health and distress, but I just wanted to draw your attention to these particular impacts that are starting to arise from the research that's being done by the National Mental Health Commission of the major impacts that digital technologies are having. Next slide, thanks. So finally, we know that from a Beyond Blue survey that was done only very recently, these are some of the concerns that parents have. So more than half of parents are concerned about their child's mental health. 1 in 3 are extremely concerned, and 1 in 3 parents report their own poor mental health. They're either feeling unsettled or they're struggling. And relating to screen time, what's interesting is even though this survey was about parents of children aged 5 to 12, for their kids, the parents' top concerns, and look at number 2, number 3, screen time and social media. So their children are young, they're 5 to 12, but parents are really concerned about 51 said screen time, and 39% were talking about concerns around social media. So wanting to unpack that a little bit is the fact that, obviously there's still concern that the kids are working and using digital technologies, but we're not really clear what the impact of that is. And we're worried that there will be some level of deleterious impact on their kids. And just to also say, for parents, their major concerns around cost of living, lack of time and work demands is really mirroring a lot of the data that we've also found in relation to, economic trends and social trends. So I just want to add one more comment with the next slide. Thanks, Luke, if you wouldn't mind. Now with this, before I read out the slide, I just want you to shut your eyes, if you may, and I'm going to read something out to you about how some people are experiencing the digital divide. At a house in the remote Kimberley, a woman waves her phone in the air for hours, trying to get a signal to pay a bill. A man has his bank account shut down due to a dodgy phone line, which raises suspicions about scammers. And at a picturesque farm, families faced with sudden shocking deaths are unable to phone an ambulance. At one community, a man had his bank account shut down because the phone line was so scratchy the call centre suspected he was a scammer. He had to fly 500 kilometres to reopen the account in person. So the latest, you can open your eyes now, the latest data shows 11% of Australians are highly excluded from digital services, meaning they don't have access to affordable internet or don't know how to use it. This equates to 2.8 million people. Now, it's limiting people's ability to participate in society and access services that they need for their lives. And we're talking about some of the vulnerable, low-income people in the country not being able to access the services designed to assist them. So some people are doing it really tough at the moment. I hope my kind of very quick Cook's tour of some of the social and economic trends that are impacting people has, I hope you've heard one thing today that you weren't aware of or learnt. But with that, what I'd like to do now is hand over to Luke to start to talk about what we might be able to do about it. Thanks.
Thanks, Irene, for sharing some pretty powerful and really kind of concerning data across a whole range of areas. And so I guess, as Irene said, this section is really around, so what can we do about this situation? Because we know that as humans, we're pretty good at handling one challenge at a time, but when they start compounding and piling up, we can struggle a little bit. And I think a lot of people are feeling that at the moment. And so, it's never been a more important time for us to look after ourselves and each other. And of course, a lot of the issues that Irene has spoken through are really big, complex, big picture issues that require, all levels of government, private organisations, not-for-profit, community organisations, and local community action to address. There's a lot of work we all need to do together, I guess, is the short answer to what can we do about it. At Beyond Blue, I just want to very quickly, reflect on, Beyond Blue's response to some of these challenges and what we can do about it. So last year, after about 23 years of Beyond Blue, we sat back and had a little look at the mental health landscape and what was going on in the world and in Australia. And, we developed a new strategy. And that strategy was really informed by some insights that, the mental health landscape is kind of very cluttered, it's very confusing, it's very crisis-driven. And all of this can make it even harder for someone who, builds up the courage to reach out for support. It can make that first step harder than it needs to be. And we also reflected on the fact that, around half of the people who experience a mental health condition never reach out for support. And those who do often wait a really long time until they seek support. There's some research to show that people live with symptoms for an average of 11 years before they'll reach out for support. And so one of the things that we've done in response to that is to launch a new strategy that really shifts our focus and attention towards earlier intervention. And so our role really becomes, how do we help people, feel better sooner, get well and stay well? Really shifting the dial towards early intervention. So hopefully we're kind of stepping in and supporting people early before their problems have snowballed and have a really big impact on their life. And then the second prong of our strategy really addresses a lot of the issues that that Irene has mentioned, where we really need to start addressing the root causes of our distress. And if we can address those root causes, we will prevent many people from experiencing a mental health condition in the first place. So that looks like, advocacy around some of these drivers of our distress, things like cost of living pressures, loneliness, discrimination, child maltreatment, bullying. There's a whole range of factors we need to address that are really the root causes of rising rates of mental health concern. So it's really a two-pronged approach that Beyond Blue is doing. Earlier intervention for the individual, and then prevention action to kind of address the drivers of our distress. And obviously, we can't do this by ourselves. We're really looking forward to working with other organisations and governments and local communities to really bring this strategy to life and make a difference. In terms of bringing this down to ourselves as an individual and what can we do about this situation and the impact it has on us, I always find it helpful to start by grounding everything back into the good old trusty mental health continuum, which really suggests that we all have a level of mental health. It can range along this continuum from thriving at one end through to unwell or severely impacted at the other end. And our position on this continuum isn't fixed. It's very dynamic. We can move up and down depending on what's going on in our lives, experiences we're having, events that are happening to us. And so we know that when some of the hard stuff of life gets thrown at us, a relationship breakdown, a job loss, business pressures and struggles or uncertainty, we can slide down the continuum towards the orange or the red zone. But equally, we can also influence our mental health positively by actions we take, by support we get from other people, including health professionals. We can, march ourselves back up to the healthy end of the continuum as well. And so a lot of the way, and Irene mentioned this at the very beginning, is really trying to think through, what's within my control versus what's out of my control. It's a helpful way to frame, how do we take effective action? And one of the models that I really like that helps us do this is, it's a very old model from the late 80s. It's the spheres of influence model, which kind of says that, when we're faced with these really big challenges, it can help to organize ourselves so we're directing our energy to where it's going to make the most difference. And so the three spheres, the three circles that this model works through is the outer circle. Really, it's the circle of concern. So these are all of those issues and challenges that we care about and we're concerned about, but we can't directly influence ourselves. So these are the macro trends that Irene has spoken through. The next circle is really around our circle of influence. So these are things that we can do with other people to try and change the things we're concerned about. So it might be getting involved in community projects. Maybe it's making a difference through our workplace. Maybe it's educating our social networks or getting together to do things that make a difference against the issues of concern. And then the inner circle is our circle of control. And these are the things that we have direct ability to change. And this is largely our behaviors, our actions, our attitudes, our decisions. These are things directly about us and what we can control. And so, for example, if you're very concerned about cost of living pressures in your circle of concern, there's not a lot you can do about that as an individual. You can't change the interest rates from the bank. You can't change the price of groceries. But if we bring it down a circle, how might we work with others to influence? So maybe you could volunteer at a food bank. You could, join a campaign to help raise the rate for people on income supports to help lift them out of poverty. Coming down to your circle of control, you might decide in your business, we're going to make sure that every client knows all of the government payments, all of the support services that are available that can help people get some relief at the moment or get the support they need. Or maybe you might say, I'm going to make sure that I have a really direct conversation with every client just to see how they're going, just to check in, how are they coping with everything at the moment, and let them know, what supports are available, or just be an ear to listen to any worries they've got at the moment. These are, I guess, ways we can cascade down the big picture into our immediate actions that can make a small difference, which we know can add up over time. The other model that can be quite helpful to think about is our coping styles, of which we know there are really two main types. We have emotion-focused coping or we have problem-focused coping. And each of these coping styles has their pros and cons. We really need both to be able to handle, big challenges like we're facing. So emotion-focused coping is really about managing our emotional response to a problem without trying to solve the problem. And so when we apply emotion-focused coping, we're really largely drawing on our social supports. We're talking to others about how we're affected by the issue. We're processing it. We're creating some order from the chaos in our mind. We're kind of just being there for each other. Another strategy within emotion-focused coping might be reframing. So you try to interpret the situation in a healthy and balanced and realistic way, making sure that you're not kind of catastrophizing the situation, that you're able to see the silver linings, the opportunities, as well as some of the despair and hardness that goes along with the issue. Or you might use kind of mindfulness and acceptance techniques to help yourself kind of stay in the present moment rather than living out all of your worries and anxieties, about the future today. Or you might really just be creating some space for the fact that you're feeling really sad about the state of the world, or you're feeling really, really worried about it, and just giving yourself permission to feel those feelings at the moment. This is the bucket of emotion-focused coping. The other bucket is what we call problem-focused coping, and this is when we try to take action to resolve the problem or to address some of the root causes of the problem. And so this is really the strategies here when you might go into planning mode, where you might, so if climate change is something you're really concerned about, problem-focused coping, you might come up with a plan to reduce your own carbon footprint, or you might seek out information to better educate yourself about the issue, or you might take action by, volunteering for a climate council group. You might advocate for, effective government policy around climate change. You might join a community group of interest where you get together and talk about what can we do in our local area to kind of improve our environment. Or you might try to develop your skills around, sustainable technologies or effective advocacy techniques, or whatever it is. This is the bucket of problem solving. And I guess the trick with these is you really kind of need to use the right coping strategy at the right time in a way that helps preserve your own energy and your own well-being, but also makes you feel as though you're being a positive agent for change and are doing things to address the problem. And that getting that balance right between the two of them is called adaptive flexibility. And so often we need to spend a little bit of time processing our emotions in order to be effective, but it's really the balance of the two that can be quite effective. And this plays out in minor details as well, in your relationships with your friends, your family, your clients. Sometimes someone comes to us with a problem and we really, might need to figure out, am I trying to solve a problem for them, or am I really just helping them with some emotion-focused coping, creating space for them to offload and share a burden? They don't really want me to solve it. They just want me to listen. And so it can sometimes be helpful even to ask, like, what would be helpful right now? Do you just want me to listen, or do we want to come up with some ideas to solve this situation? And when in doubt, I would suggest kind of starting with emotion-focused coping before moving on to problem-focused coping. The other thing we can do is sometimes, when we're facing a little bit of a life storm, we really just kind of need to bunker down and prioritize our own well-being and doing the little things we know that help preserve our mental health and well-being. And we have recently done a really amazing project with our Beyond Blue community, including many people who had a lived experience of a mental health condition. And we wanted to create a well-being tool. And so we effectively said, like, how do you look after your well-being in the face of challenges that life can throw up at you? And what might a tool look like that helps you plan to do that more proactively so you can stay well? And so this is the tool that we've created that I'll give a little brief summary of now. And I've got a QR code on the slide as well if you want to go directly to the tool and check it out. So in the process of building this tool, we heard 3 really key insights that came out from people who have had to manage their mental health while going through significant life adversity. And the first thing we heard was that, for them, their well-being was built from many small moments. It wasn't a one-off action. It wasn't anything big and dramatic. It was really just the accumulation of small moments of pleasure and purpose that kind of added up and built on themselves over time in a way that felt good for their well-being. I guess one way to think about it is these were kind of the flecks of gold in your day rather than big gold nuggets that make a big difference. It's that, that small moment of walking your kid to school, of watering the garden, of having a chat to the neighbor, of making progress towards a goal. These are the kind of small moments they were talking about that were well-being moments, they called them. The second insight was really that people have learned over time what it is that works for them and their well-being. They are kind of the expert in their own experience, and they really want to be able to do what works for them rather than being told, oh, you must be running 3 times a week. You must get off your phone, before bedtime. All of these things that they should be doing seemed less powerful than them learning through trial and error. What are the 3 or 4 things that reliably work for me? I want that expertise in my own experience to be validated through this wellbeing tool. And then the last thing was they just wanted a simple recipe. People are very busy, very time poor. They just wanted a quick and easy way to think about their well-being each day in a way that wasn't too onerous or burdensome, and just to remember what they need to be doing that's in their best interest. And so that led to the creation of this very, very simple 3-step process where step 1 was around, a tool that helps you identify what is it that works for you. And when we categorized all of the actions that people took, they really fell into 4 buckets that we've summarized by the acronym of PACE. And so the P stands for pause. And so pause are really the actions that help you take the pressure down. It's the stopping, it's the resting, it's the reflecting, it's checking your self-talk, it's slowing your breathing, it's having a do-nothing Sunday, whatever it is that helps you to press pause on a busy life and stop the inputs for a moment. The A stands for act. And so these are the actions that help you kind of function well. It's physical activity, it's nutritious food, it's getting enough sleep, it's having a feeling of achievement and accomplishment, it's feeling useful, even in a small way. This was the act. The third bucket was connect, and this connection not just with other people. We know our relationships with other people are actually the best predictor of our mental health, so they're really worth investing in. But it's also about connection with nature, with community, with culture, with spirituality, with the planet. Connection was a really deep source of well-being for the people that helped us make this tool. And lastly, it's enjoy. So these are the things in your week that give you a laugh, you have some fun, it's creativity, it's a hobby, maybe it's learning something new. And so these are the 4 action areas of this tool. The second step is thinking about, why does this action help me? And so it's really about trying to join the dots between the action and then the benefit it gives you to strengthen your memory around, this is why I do this thing. And so for some people, it might be, oh, I go for a walk at the end of every day because it just helps me flush the stress out of my body. It feels really good. Or, when I'm feeling a little bit under the pump, I make sure I listen to this album, which I love this album when I was younger, and it makes me feel young again. It fills me with great memories of that time. So I listen to that album and I just need a little bit of a pick-me-up. And for other people, it's anything from, I just I go back through my phone and I look at photographs of friends and family, and it just kind of reminds me I've got people I really care about in my life, and I feel really grateful about that. It's just these little tiny things. And then the third step is just a gentle intention to plan to do these activities regularly. It's not about being hard and fast, that you must do these things, or you're going to beat yourself up if you don't do these things. Just that gentle intention of, I'm going to try and keep this front of mind and do this just sprinkled throughout my week, just as a little top up for my well-being when I need it. And so this is the kind of the well-being action tool that we've developed. Page 1 explains everything I've just said. Page 2 is a little tool that you can fill out for yourself, your own answers for what works for you. And page 3 is some suggestions and tips that we've taken from the research, we've taken from the people that helped us design these tools, just some small actions that you might take to, think about whether you might want to try these actions and whether they work for you. And if they do, you can pop them in your plan on page 2. And so that's our wellbeing action tool, which can be super helpful for grounding yourself when you're feeling a little unsettled and you need to prioritize your own well-being. But sometimes we know, self-care in and of itself isn't enough, and we kind of need some extra support. And there are kind of two things that happen when we enter this zone, which Beyond Blue calls kind of the unsettled zone. And two things that happen is, firstly, we tend to minimize ourselves. We kind of invalidate our own experience as not being bad enough to warrant doing something about it, because others have it far worse than me, or others have a much bigger set of problems than I do. And so that can sound like, I'm okay, others have it worse than me, or no, I'm hanging in there. Things could be worse. I've got a lot to be grateful for. It's just kind of this minimizing of our own experience of feeling a little unsettled. And then the other thing that can go along with that is what we often call the mask of coping, where we kind of try to present to the world that everything's fine, everything's going okay. But on the inside, we're actually feeling quite overwhelmed. We're feeling quite stressed. We're feeling unsettled. We're full of worries. Maybe we can't sleep. Maybe we're kind of losing our confidence a little bit. Maybe we're being a bit self-critical in ourselves. And so all of this inner turmoil can be going on, but we kind of put on this mask that everything's okay. And obviously, this is a really exhausting way to turn up to life every day. And people tend to kind of, soldier on, trying to get through until their problems escalate and become more and more severe, and they just can't do it anymore, which is often when they reach out for help. So I guess a lot of our messaging at the moment is about, let's not wait for problems to snowball. Let's reach out earlier. It's never too early to reach out for support. Let's get on top of these more unsettled feelings before they escalate into something bigger. And so we will all know the signs that we might not be going well. And for each of us, we kind of have our own signature of signs that when we're not doing well. For me, I know that if I'm feeling a bit overwhelmed and stressed, my sleep is the first thing that goes. I stop kind of physical activity because I'm so focused on the problems I've got to solve. And I can kind of I can kind of berate myself if I make mistakes. They're my signatures that, I've got a bit of an orange flag here. It's really great to know what your signature is as well. And for our clients, we've also, as tax practitioners, we've popped down on the right-hand column here, what are some of the financial warning signs that you might notice in your clients that raise that eyebrow, stuff that you'd be super familiar with? It's a lack of savings, a lack of awareness of budgeting, behind on payments, maybe impulsive financial decisions, or maybe a sense that they're kind of feeling a bit overwhelmed and helpless, that they'll never get on top of their financial situation. So that we know that our financial health and our mental health are very linked, and they're kind of two sides of the same coin, and they can go up and down together. So if you notice concerns in one of these areas, it's good to have an eye raised for other concerns. And obviously, the more signs you're noticing, the more concerned you can be. And obviously, and I know that we've had a few of these webinars over the years, so I won't kind of go on too much about this, but when you are concerned, about someone, it's really important we do check in and have that conversation to ask, is everything okay? And ask really directly, so that we're both clear that this is a conversation of me saying, I'm kind of concerned and worried about you, and I'm checking in. And sometimes we might be the only person who has that conversation with them, and our support and just acknowledging that we've noticed you're not yourself lately can make the world of difference. And once you've asked, we try to not interrupt. We just provide that listening ear, be open-minded. We try to be non-judgmental. And then lastly, we support them. We help reassure them they're not alone. Our role is not to be the counselor or the expert. It's just to help them explore their options for what's going on, stand beside them, put the options on the table, and help them figure out what they might do next. And when it comes to their mental health, there's a lot of options we can recommend to them. But it's also important to remember that often people won't kind of unload in that first conversation. It can take a few conversations before they're comfortable enough and trust you enough to give the full story. And sometimes it's just about planting that seed that, you're someone who's willing to have that conversation. You've noticed, you care, you're the kind of person that can have that mental health conversation, which is really helpful for someone to know they've got someone they can go to when they need to. In terms of what are the support options you can link people into or yourself, obviously seeing your GP is a great first step. Calling Beyond Blue is a great first step. There's a whole range of online programs and supports at the moment. there's a government website from the Commonwealth Government called Head to Health, which has all the information and programs you could possibly need, and it's really worth checking out or directing people to. Or your workplace EAP is another great first step if you have one. I'll just quickly touch on a Beyond Blue program, which you may be familiar with because I know we've mentioned it in previous sessions. But our New Access for Small Business program was created back in 2021 when we noticed that small business owners experience higher rates of mental health concerns than the general population. And so we created this small business a support service it's a national support service where you can ring up and speak to another small business owner who understands the pressures of running a small business, but they've been trained and they're highly trained and supervised to provide a mental health coaching service that is 6 sessions with this mental health coach and then 2 follow-up sessions. And the results we see from this program are kind of absolutely phenomenal. We get about 7 in 10 small business owners that get into the program have a recovery from their depression and anxiety. 90% report that they feel more able to cope and get back into their business. It's a really tremendous kind of service, which has just had a funding extension announced in the latest budget. It's now available until the end of June 2026. So it's really one to think if you have small business clients and you're wanting to suggest they link into support that's really kind of going to get the pressures of what they're facing. New Access for Small Business Owners is great to keep in mind. And just because I'm so rapid with the data, I put a graph in. I thought let's put a graph in to show the decline in depression and anxiety scores that people get that go through this program. And really excitingly, the results last. When we follow them up 6 months later, they're still on top of their mental health. Their depression and anxiety hasn't returned. It's a really incredible program getting absolutely fantastic results. And of course, keep in mind that Beyond Blue is always here. We have online forums for peer support where you can start a conversation about a particular issue that's of concern, or you can join a conversation and share your experiences and learn from others' experiences. And of course, there's the support service itself, the phone, the web chat. You can contact them on email. There's kind of lots of options if you're worried about yourself or someone else and what you might suggest they engage with. I'm conscious that we have completely run out of time. We have about 3 minutes, and I can see we've got a lot of questions in the chat. I'm absolutely very sorry for my terrible timekeeping. I'll just stop sharing the slides for a moment and see if maybe we can knock 1 or 2 on the head very quickly. Irene, I'll just tackle a top of one. This one from Shane. Can you elaborate on what you mean by preventable disease when referring to men?
It related to men's mental health conditions, and certainly in terms of their men tend to seek help less often and appear at health services less often. So that's what I meant by the fact that they may present eventually or experience health conditions, but they can be preventable if they were treated earlier.
Right. Thanks, Irene. I'll quickly hit a NASBO one on the head. Is NASBO quick to access? Not being put on a wait list? Is it run by volunteers? So in a nutshell, NASBO does not have a wait list. You can access it nationally. You don't need a GP referral. It's free. So you can really call up and get started, very quickly. I think the commitment is after you make your initial inquiry, some will be in touch within 48 hours to start the process. It's a really great service. And sorry, Luan, for running so long on the slides that we didn't really get to as many questions as we would have liked to.
That's all good. Thank you, Irene and Luke. That was a great presentation, addressing a very relevant and contemporary issue affecting us all. I got a lot of useful information from that, and I'm sure our audience did as well. If you'd like more information and to keep up to date, please visit our website at tbb.gov.au. And you can also follow us on LinkedIn, Facebook, and Twitter. We also have a newsletter that goes out each month called TBB e-News, which you can subscribe to at tbb.gov.au/newsroom. And you can also subscribe to our YouTube channel to receive notification when we post new videos. We record all our webinars and have a comprehensive library of webinars available for you to view at your leisure. So you can still claim CPB for viewing these videos as well. So once again, a big thank you to Dr. Luke Martin and Irene Veras for your insights today. And we hope you found this webinar beneficial. As we've said, it counts towards your CPA, and you can claim 1 hour for attending. So before we finish up, I'll be launching a quick exit survey, and we appreciate if you could take the time to complete the exit survey. And it only takes a few moments, and your feedback will help us to improve our webinars and let us know what topics that are of interest to you. And so the survey will open in your browser once you leave the webinar. Once again, thank you for joining us today.